that vaccine and the efficacy and the length of duration of protection really matters. We see that being boosted really makes a difference. We see that being up to date is important, and we are hopeful that we can prepare as we move into this time of transition to make the changes that we need to make by getting vaccinated, getting prepared, and being ready for what comes ahead, and still move forward with keeping schools open and businesses open and enjoying the things that we like to in our lives. We are looking at data and following science. We see that there are new reports out that if you are pregnant and you are vaccinated, that you can protect your children and decrease the likelihood of them developing COVID after they're born. We're seeing that if we vaccinate those who are immune compromised with that fourth shot, that we can give them more protection. We now know that our immunity doesn't last as long as we thought. So we've started asking folks to get that third shot, the booster shot, 5 months after they've gotten that primary series of mRNA and 2 months after the J&J. We look at what's happening and see that Omicron may have caused milder illness in a lot of people, but it ran through our community like wildfire, and it got to those vulnerable people, those people with high blood pressure or diabetes or lung disease or cancer quickly, and it got to those who were unvaccinated quickly. And we saw that it is important for us to take those steps to make sure that we can't get this virus going forward. It's not over. The pandemic's still a pandemic and classified as a pandemic. But we do look as though we're approaching a time when we can say we have herd immunity. We're looking at the calculations. We're factoring in the fact that there's 69% of our population hasn't been boosted yet. So we're looking at what we can do to move forward and make it so that we can get those people boosted and continue on with our lives with less of the inconvenience, as some people find, of wearing masks. We know masks work. We know that social distancing works. We know that staying home when you're sick so that you don't spread it to somebody else works. We know that if we're going to go and visit people that we don't live with normally, that if we test ourselves to make sure that we're not taking something home to grandma or to your cousin who's being treated for breast cancer. We know that if we do that, we protect those that we love. And we know that if we get vaccinated, we protect those that we love. So we hope that you will walk this walk with us to the new normal, through this transition to what hopefully will be a time when we are living with, successfully conquering a virus that is deadly and that has ravished people in this surge and in previous surges. And with that, I'll pass it on to Director Stirrup.
Thank you, Dr. Walks. I'm going to pass the mic to Janet. She's going to follow up with some important epi data.
Good morning, everybody. So as Dr. Walks mentioned, we are seeing a substantial decrease as we come off of this Omicron surge and peak, and we're on the downward slide with, as we mentioned, hoping to get back to some level of normalcy in our community. You know, one of the indicators that we do kind of track is just looking at the demand on some of our operations that we're conducting through Austin Public Health. And so what we're seeing currently is that our testing operations have decreased significantly. We do still have the federal team that is in place at Metz Elementary. They will be moving out on Monday, and Austin Public Health will be consolidating operations from Dove Springs and the Travis County Exposition Center into Metz Elementary to take over that spot and continue serving the community. Those testing operations will begin Tuesday from 11 a.m. to 7 p.m. at Metz Elementary, and it's located at 84 Robert Martinez Jr. Street in East Austin. You know, again, some other changes that we're making and one of the things we've learned and lessons learned from this Omicron surge, where we had huge number of cases being reported into us on a daily basis, that we need to make some major revisions to our dashboards so that we're providing information that is, one, aligned with the Department of State Health Services, because they've recently made some changes to their dashboards and we want to be consistent with them, but also to provide the community opportunity to see cases and see what the true disease burden is in our community. So we will be making some major revisions and changes to those dashboards and some of the key indicators next week, and those should go live sometime next week. And really, one of the reasons and one of the goals, it's something that epidemiologists have been wanting to do for a period of time, and we just haven't had the time to do it, but we have had an opportunity to begin to clean our data and hopefully include information. We'd like to include laboratory confirmed positives, which are considered probable cases. We haven't done that historically, and we are going to be doing that in the new dashboard revision. So we hope that information will provide the community a better idea of what the disease burden is in our community. And, I think the best information we have, the best we can fine tune and prepare this data for you will help you with your decision making as you move forward. As Dr. Wachs mentioned, we are seeing substantial decreases in a lot of our key indicators. However, I just want to remind people, there were 66 people who died from COVID in the last 2 weeks. And those individuals have families that are grieving as a result of COVID. And so, the risk is not gone, and people need to continue to be vigilant. I have an elderly mother who lives at home with me, and I do all that I can to protect her when I'm out and about. I try to continue to wear a mask so that I don't bring something home to her, and I try to keep her safe. And I think as we move forward, Austin, we need to make sure that we're doing the right thing for our family as we go out and about and begin interacting in the community. And with that, I'll turn it over to Cassie DeLeon.
Thank you, Janet, and good morning. We come to you today and to note that this community, the Travis County and Austin community, has done a great job in taking up the call to get vaccinated. We have 72% of our community that is fully vaccinated, and that's incredible. That's higher than the state of Texas. That's higher than other major metropolitans in Texas. Y'all have done fantastic. And as a community, we've championed vaccines. We are doing such a good job of protecting ourselves and protecting each other by achieving that goal of getting over 70% fully vaccinated. But we have a new task. Locally, now we really need to think about the population as a whole getting up to date on vaccine. And being up to date means that you are getting your booster dose. We know that a little over 30% have actually received their booster, and we know that majority of our vaccinated population are due for their booster. So we want to really encourage folks to go out, get boosted. And then if you are a parent of those that are from 5 to 11, we know that they're still under vaccinated. They are still at about 32% not fully vaccinated. So we need to get those children vaccinated so that they have that protection. Up to date is a really important space to think about because it's one of those things when we look at vaccine schedules for all different types of vaccines that we provide, measles, mumps, rubella, flu, for example. You want to make sure you're staying up to date with what the recommended vaccines are because and particularly in pandemic. It helps to prevent outbreaks. It helps to prevent future surges. It helps to prevent the hospital from being overwhelmed by COVID cases. And at the end of the day, it helps protect those vulnerable high-risk populations and those populations who cannot get vaccinated because they're not recommended yet, like our very young. And then those populations that, may not be able to get vaccinated for a myriad of different reasons. And so it's very, very important that we think about protecting ourselves, but also thinking about the vaccine is a way for us to pay it forward and protect others in the community. So encourage y'all as we look into the weekend to make a plan to get vaccinated. There are a lot of spaces and places to get your vaccine. Look towards those and work towards getting your family protected and our community protected so that we can continue to tamp down this virus, and looking ahead to spring activities. And so knowing that we are all able to participate fully and we don't have to worry about the risk of spreading this to other people. And with that, I'll pass it over to Director Stirrup.
Thank you, Cassie. Two things stood out from the comments put forth thus far from my colleagues. One, that 66 people have died over the last week from COVID. I have a colleague who had to go to a funeral for her aunt, who was only 64 years old. And as she told me the story of going to that funeral, and, she said, again, I lost another family member to COVID. She has been with me through all the major stages of my life, and I can't imagine what it's going to be like going forward. And then when Cassie said that it's important to pay it forward, yes, we are making great strides. Yes, some of the key indicators are moving down, and we're all tired of wearing masks. But we can't simply make this virus go away because we're tired, or because we're fatigued, or because we want to get back to what we feel is normal. We do have to continue to pay it forward. Everything that we teach our children is about a collective sense of responsibility. And this is where we need to lean in and continue to model that behavior that we want for our young people. Just because I buy a Porsche doesn't mean that I can do 95 down 183, right? I still have to obey the traffic laws so that I keep myself and other travelers safe. And this is what we're talking about with respect to COVID. And if the easiest thing that you can do is to wear a mask, to keep yourself safe, to keep a colleague from having to go to a funeral for a close relative or loved one, to keep your elderly grandma, papa safe, then this is a seemingly easy thing to do. And I'm sure the 66 families that have been impacted by COVID just in this last week would appreciate that. And with that, I will open us up for questions.
Our pool reporter today is Sangeeta Menon from KUT. She's going to ask questions on behalf of news outlets. Sangeeta.
Thank you. The first question is from KUT. There were 1,632 new cases reported on Thursday. That's a significant jump from the 699 cases reported on Wednesday. Is this a result of the batching process being used to enter the backlog of cases? If so, where can we find the real number of new cases reported each day?
So yes, I'll take that. It is a reflection of batching that is occurring. So we have cases that are entered both manually by data entry. I would say in the last week or two, many of our numbers have been fairly consistent as far as the number of labs we're receiving each day, and then we've gotten to the point where our data entry staff are able to actually enter all that we receive in a day. However, our daily case counts will be affected by these batches that we're trying to send up to eliminate the backlog. Ultimately, our goal is that the process will be automated so that the number of cases received will automatically be uploaded into the system. However, we do still require data entry to continue to occur. We have that information in-house. We could get it, but it's not necessarily available on the dashboard at the current time.
The next question is from the Austin American Statesman. Will the community transmission rate average need to stay below 100 before APH would consider shifting to stage 4? Or is the weekly average of daily hospitalization staying under 50 enough to shift stages?
As we make decisions on adjusting from one stage to another, we take into consideration many parameters, the two that you just mentioned, the 7-day moving average of hospitalizations, and also the community transmission rate. But the overall goal is for us to look at the situation in its entirety and make sure that we are making a decision that will allow us to continue the movement downward. And so we will continue to assess the situation and make a change in stages that is consistent with moving in that direction, which is to get down to stage 4 and ultimately down to stage 3, to et cetera. So those are the things that we're doing right now.
And I'd like to just add on to that. You know, again, I think some of the basis for changing stages, we need to look at all the data in totality. So it's not necessarily just always looking at community transmission rate or hospitalizations, but it may be looking at our number of deaths, which our deaths are extremely high over the last 2 weeks. As Adrian mentioned, 66 deaths in 2 weeks. But you know, we want to make sure that when we do make our decisions, we're making decisions based on science, and that science is sound. And so we try to look at a number of different factors in that decision-making process.
The next question is from KXAN. What mitigation efforts are in place for this weekend's marathon? What role did APH play?
The marathon has worked closely with APH and our event staff to take into consideration the situations that would occur during a marathon where there would be increased transmission, and then took those steps to decrease the risk in those situations. So, for instance, there are delayed start times. There are several different finish lines so that congregation of people that are breathing heavily in a situation where there may be transmission is decreased, and then masks will be handed out at the end of the race. And so all of that, in addition to participants being vaccinated or having a negative test, all of those things factor into us ensuring that the risk of spread of the virus in that marathon is decreased and that the marathon can go forward as safely as possible.
The next question is from KOOP Radio. How meaningful are high community-wide vaccination rates when certain neighborhoods and demographics within our community still remain very low? What can we do to increase community safety given these disparate vaccination rates?
Part of that concept of herd immunity is to have enough people in a group protected so that if one person becomes infected, that cannot spread as easily in the group. And so what we're looking at now is where we are in that continuum. We know that we have X number of people vaccinated, X number of people boosted, a certain number of people who've had infection. We have science to show us that there's a level of protection that's greater and a duration, a length of protection that's greater for those who are boosted. And so we're taking all of those factors and looking at whether we can do things to change the way we're mitigating. But to this point, masking since the beginning of this pandemic, social distancing, staying home when sick, all of those things that keep us from spreading an infected viral particle from somebody who has the infection to somebody who doesn't, those measures have been effective. And so we are continuing with those until we look at the numbers that we have, and then we can make decisions on how we navigate through this transition period.
The next question is from CBS Austin. Do you think the Austin area has reached, quote, herd immunity status for COVID and the Omicron variant?
As I was just discussing, we are looking at where we are from an immune status, from a protection status with regards to this variant and with regards to COVID in general. This is a deadly disease. We protect ourselves by being vaccinated, by masking and social distancing, and we will make those determinations going forward, share those, the advice with the public, and move forward through this period of transition. And our goal is to protect ourselves so that if a new variant presents itself, that we will be ready and able to keep it from spreading in our population and affecting our loved ones and ourselves.
The next question is from KUT. What do you attribute the recent high number of deaths in Travis County to, considering Omicron was thought to be a, quote, milder variant?
COVID-19 is a deadly virus to some and more so to those who are vulnerable. Omicron may have been a mild illness in people that are vaccinated or those who do not have any underlying medical conditions. But to those who are elderly, to those who are unvaccinated, to those who have comorbidities like high blood pressure, diabetes, cancer, this virus can be and was and is deadly. And what we're seeing right now is deaths that are occurring at the end of a surge, because that is the course of the disease. It starts out with the initial symptoms of sore throat, cough, slowly progresses to chest discomfort, trouble breathing, and then those who are unable to fight this disease with their immune system, they can end up needing support, life support. And that's been the case for each of the surges that we've experienced. So this virus is deadly. It is important for us to protect ourselves. It's important to get vaccinated. And it's important to wear a mask when you're indoors around people that you do not know, especially if you're at high risk for a poor outcome.
The next question is from the Austin American Statesman. How soon does Austin Public Health expect it will shift down to stage 4? As early as next week? 2 weeks from now?
The trend that we're seeing right now is that we could be in stage 4 possibly in the next 10 days or so. But again, it is all up to what happens in our community. As public health professionals, we deal with population health. And that's a fancy term for what's the community going to do. If the community continues to work together to get vaccinated, to protect itself with masking in indoor public spaces, we can look forward to making the changes that we all want to make. We're all tired of wearing masks, but we all know that we need to protect our loved ones. As many have said, many of my colleagues have said, we all have a relative or loved one who's vulnerable, and we are doing what we can to protect ourselves so that we can protect them. And that needs to continue to happen so that we can continue to trend downward.
The next question is from KXAN. The CDC director said this week that they wanted to, quote, give people a break from wearing masks. Would adjustments be made in the risk-based guidelines should the CDC pass down new mask recommendations?
We're living in a community where we are making adjustments in our risk-based guidelines based upon data that we collect, and then we assess with modeling through our professionals that are biostatisticians. This is a process that has been undertaken throughout this pandemic and will continue to be. We have a unique set of circumstances in our community. We have decided that we are not going to mandate vaccinations. And we've decided that personal choice is important. And working within the framework of where we are as a community requires that we have community acceptance and buy-in to those things that we've all collectively agreed to do. So with that in mind, we will take the recommendations of the CDC, align ourselves with those recommendations, and then develop risk-based guidance that incorporates all of those things.
The next question is from KOOP Radio. In consideration of public perception that communities are immune to COVID on account of widespread Omicron infection rates, how is APH working to get skeptical, reluctant, or resistant community members vaccinated?
I'll start with that one. APH continues to work to give information and to help folks navigate all the information that's out there. There's a lot of misinformation. And so we want to ensure that everyone knows what their risks are without getting vaccinated and what the benefits are for getting vaccinated. We also work with physicians to encourage them, to encourage their patients to get vaccinated, and other groups to make sure that we're all on the same page as far as what the message is and that they're science-driven decisions. We really want to ensure that those who are on the fence, considering vaccine as a healthy choice for them, that they have all the information they need so that they can make that decision. In particular, parents of children who haven't been vaccinated yet, we want them to have those conversations with their physicians, with their pediatricians, look to credible sources to make those decisions, because the vaccine is the best choice for protecting individuals from COVID-19. And so we want folks to know how to navigate that and make those personal health decisions in consultation with their physician and in consultation with credible sources regarding the vaccine. We also want folks to know that their personal choice to get the vaccine does not just affect themselves and their loved ones, it affects everyone they may come into contact with. Again, this theme of paying it forward, it's really important to think about that as a community, collectively getting the vaccine. It's more than just about the individual choice. Our individual choices now affect our entire population.
Thank you, Cassie. And just to add on really quickly, as a department, we do understand that personal choice is important, but we also recognize that personal choice is impacted by historic misuse and abuse in certain communities. And we are sensitive to that fact, and we will continue to work to be consistent in our information and in our approach to continue to build that trust and that two-way dialogue to support individual choice, and also to give recommendations to our policymakers, because we're not going to program our way out of COVID. And so it'll be a combination of good programmatic efforts that are culturally relevant and respectful, as well as making sure that we have policies and resource decisions in place to support each and every Austin Travis County resident in making the best decision for themselves.
The last question is from CBS Austin. Do you think a fourth shot is likely for the general population? How soon do you think that is likely to be recommended?
We're following the science, and that's happening locally and nationally. And the Advisory Committee on Immunization Practices, ACIP, has an ongoing dialogue about things such as the fourth shot for the general population. We're going to follow the science. If the science shows that that fourth shot is required, then it will be recommended. What we know now is that we have a large portion of our population eligible for boosters. Boosters will help protect you from developing severe disease. And for those who are at risk for poor outcomes from COVID-19, it will help prevent hospitalization and the succumbing to the disease and dying. So at this point, we are not guided to have a fourth shot, but we are definitely guided to get boosters. And in this time when we have many events on the offing, March break is coming up, it's important that those who are eligible for boosters go out and get that booster shot and protect yourselves so that you can protect not only yourself, but your loved ones.
And that was our last question. We appreciate everyone joining us. Thank you to our health authority, Dr. Desmar Walks, APH Director Adrian Stirrup, Chief Epidemiologist Janet Pichette, Chief Administrative Officer for Disease Prevention and Health Promotion, Cassandra De Leon, and to our pool reporter today, Sangeeta Menon from KUT. We appreciate everyone joining us. Have a safe and healthy weekend.